I'm
nice to
doing
meet
very
you.
well, sir. Come over, have a seat, and
Oh, okay.
thank you for participating in our live stream today.
So today we're seeking tooth replacement options for your lower teeth, correct?
Yes.
You currently have a denture on the upper that you're happy with.
Yes.
And you've tried partials and you did not like the results of them, correct?
Yes.
Okay. You're not having any pain or anything, but you had a deep cleaning in your history about 2 years ago.
Yes.
And you had a regular cleaning about a year ago. And today we're trying to figure out what we're going to do with your lower teeth and the implants together and come up with a plan. All right, well, let me go ahead and have Dr. Vasco figure out what we're doing for you.
All right.
Very good, very good. Tell me, you had these top teeth for some time, right?
I've had the top dentures now for about 4 years.
4 years, right?
Yeah.
So at that time, what was the plan for the bottom at that time?
It was kind of wait and see. Money was a little scarce then.
Okay.
And so they did the in-house financing there. And I got those paid off.
Okay, good.
And then with the bottoms, it's just, I mean, now I think I'm financially okay.
Good.
And I think I can probably, you know, afford a little bit
Okay.
better dental care.
Good. Good.
So.
Very good. And then you also made the comment you had severe gum disease and the teeth were going back, right?
Yeah, and also, you know, many years of drug use too.
Okay.
So,
Okay.
you know, so I imagine that probably sped the process of the.
And since you had these teeth done about 4 years ago on the top, have you been going to get your bottom checked on a regular basis?
No. I probably should have.
Then you wouldn't be here, right?
No, probably. Well, I'd probably still be here. These are pretty bad.
Right. Okay.
Yeah.
Okay. All right. Very good. Okay. Well, let me take a look and see
Okay.
what is going to be.
All right.
What is your status, and then we'll talk about some of the options.
Okay.
And then I'll go from there.
All right.
So it sounds like you're already aware of what dental implants are, what your options are. So tell me, what are you thinking right now? Yeah.
Like what my plan is?
Yeah.
I was thinking maybe possibly doing implants here.
Right.
And then pulling these out and maybe doing a partial here.
Okay.
And then letting those heal.
And
then maybe possibly doing a couple more implants.
Okay. Gotcha. Okay.
But whatever, and then also what you think would probably be best.
Fantastic. So question for you. When you're thinking about replacing your teeth, is that something that you want completely fixed, or are you okay with the removal option?
I think I'm okay with the removal option.
Removal option.
Yeah.
Now that you have on the top that you have a removable, right?
Yeah, absolutely.
And also you want something that fits your budget as well, correct?
Yeah, well, yeah, that too, and also
right.
You know, my parents have dentures, and they, you know, they tell me the bottom, it's the hardest part to do dentures.
Good job.
So they got.
Did you watch your parents, or did they tell you?
They told me.
They told you.
And my dad, you know, he got the bottom, the plate, the implants, and I mean, they look kind of big, and they look a little large, and I think it's the place we go to.
Right.
We used to go to.
Well, you know, you were spot on. Bingo. The biggest challenge with the bottom ones, you know, they're like a flip flop. They're always kind of wobbly.
Yeah.
The top ones, because you have the suction, they stay okay even if you don't have any implants.
Exactly.
Sometimes if you're happy, you can get by. But on the bottoms, they're like a flip flop. The tongue is pushing your denture out.
Yes.
And your lip is pushing it in.
Yes.
So the tongue and the lip, they're fighting, and then in the end, this is going to pop up.
Right.
But if you have the implants, then the implants are going to help you secure the bottom denture, so that way you don't have to worry about the flip-flop flopping out.
Right.
So they just
and I think that's
secure.
I think that's my main worry. You know, I'm 38 years old, so I'm still quite young, and so it's
not quite young. You're very young, man. You're very young. Yeah.
Yeah.
Okay. Yeah. Look at that, this one right here.
Yeah.
So this is the flip-flop you're talking about, the regular denture?
I think so.
Right? So the regular denture is the flip-flop that you're talking about.
Yeah,
That does not have any secure components here.
Yeah.
Right? But this one right here, see that? This one has these implants right there. So when you snap it, do you hear the click?
Yeah.
See here, they're secure.
So here's my question.
Yes, sir.
Will they look Will they look real?
Yeah,
okay.
Absolutely, yeah.
All right.
Well, how does their top look right now?
I think they look real. And everybody asks me, they're like, man, you got dentures.
They look cool, man. Yeah.
All right.
We got some women coming.
Because we're supposed to be being serious.
You look sharp, man.
So here's my question.
Yeah.
And then once we do this, I was thinking about maybe doing another top plate.
Sure, yeah.
And maybe a little bit longer teeth so that way, because right now you can tell they're a little up. And they're not.
Well, I'm so glad you brought that up because anytime you're making teeth, it's always better to make them in pair.
Exactly.
Particularly, you're absolutely right. So now that you have the bottom teeth, they're not like really in shape, so they're going to come out. Now, if you're going to make the top and the bottom together, now they're going to match, yeah.
Right. I think that's probably what we should do.
Well, you already know all the answers, man. Then you already made my life easier.
Well, I just don't know what to do now. I can't do it myself.
Okay.
So I need a doctor for that.
You can do a DIY from Home Depot. All right, let's take a look, buddy. Okay. All right. Very good. Very good. Okay. All right. Fantastic.
Do y'all have flavored impression stuff?
We do have, mint flavored, yeah. Mint,
okay, cool.
Yeah,
That's fine.
Yeah, okay. Yeah,
okay, as long as it's not.
Okay.
Okay.
All right, very good. Okay. Well, let me take a look in your mouth, okay?
All right.
See what's going on here, okay? Which teeth are hurting you the most?
I don't really have any pain right now.
Okay, all right. Okay. All right.
But I'm experiencing loose teeth.
Okay.
And that's when I was like, oh God, I gotta do something.
Oh, okay. All right. Okay. All right. Which teeth? The loosest teeth. Yeah.
This one right here.
Okay. All right. And you know why they are loose, right?
I believe so.
Yeah. Okay. The gum disease caused so much of bone loss, and that's why the teeth are loose. Okay.
Mm-hmm.
Open wide for me. Okay. Open. You're gonna make you look even sharper, buddy.
Okay.
Yeah. Okay. All right.
Wayne, you didn't poke and prod.
Do you want me to?
No.
Yeah.
I was hoping you weren't going to.
Yeah. No. Go easy, buddy.
That's right.
Yeah. Okay. All right. So you pretty much know what needs to happen. You already know the answer. You know, you didn't want to be like your mom or dad, and you don't want the dentures to be popping, and you already know the answers. Implants are the best, okay? So at this point, just a matter of how we can make this happen, fit this into your budget, and then just move
Do you
on.
recommend implants like those, or do you recommend what we were just looking at?
Well, because you remember you said you had lost some of these teeth in the back and you had these teeth missing for a long time. So anytime you have teeth missing for a long time, what happens is and you get bone loss, okay? So you can see that. See here, this is the tooth right here, right? So you can see the level of the bone. But you can see here, there is no teeth. Correct. So the only way we can make things happen is to put implants in the front to make that happen.
Okay.
So you do have an option that you can just get completely fixed teeth like this. See that? These are completely fixed. They don't even come out.
What? Okay.
These are completely fixed versus the other one that I showed you that snaps in, right? See that? That snaps. Versus this is completely fixed. Do you see that?
Yeah. Wow. Okay.
So you have the option to get that too.
Okay. Well, now I guess we just have to figure out. Would you have to put bone in there?
More than likely, yes, to be
For
able
those?
to do that. Yes, sir.
But
Correct.
these, no.
These, no. Correct. Yes, sir. Right.
But will my...
The denture sitting on the bone, it's just going to sit on those implants, so it's not going to deteriorate your bone that much. Yeah.
Okay. Okay,
Yeah.
I got you.
Right.
Yeah, I mean, see what works best for the pocketbook, I guess.
Absolutely. You got it.
What do you think?
You got it. Yeah. Okay.
Yeah.
So Jasmine is going to put a plan together for you.
Okay.
Okay. And she's going to write down the options that you have.
Okay.
And then see what can be done.
Okay.
That's just going to fit your budget, and then help you with that.
Yeah. Now I do have insurance, but I'm assuming my insurance is probably not going to cover a whole lot of that.
Well,
so
I'm glad you're aware of that also.
Yeah.
Many insurances, dental insurance.
I knew I wasn't going to come in here and say, "Hey, man, I got insurance. Fix me up."
Yeah. Well, I'm glad you know that too. Okay.
Yeah.
Very good.
Absolutely. Thank you so much.
Okay. Very good, sir.
I appreciate it.
Okay.